Breast augmentation is otherwise known as breast enhancement, which means making the breast more aesthetically acceptable to the person by making it bigger. We use either breast implants, which is made of silicone, or we can do breast augmentation using fat grafting, basically taking fat from elsewhere and using it to enhance the breast. Those are the two common types. Sometimes breast enhancements or augmentation is done in conjunction with uplifting the breast. Breast augmentation is not age limited. It's more about individuals' perception about their body image, or whether they have self-confidence in how they look. Normally, we do not offer breast augmentation for anybody less than 18 years old. That's because they're not fully developed, except in certain congenital or birth conditions. Older the woman or older the person is, the more challenging the breast augmentation will be. That depends upon amount of soft tissue or the breast tissue they have, who will make a decision on whether they're suitable for breast augmentation or not. Obviously, any surgery has got its own benefits and complications. Every surgery anybody has in the body, either it's a small scar, small risk of infection, patient can bleed, that means may get a blood clot. Those are the common complications with any operation. Particular to the breast augmentation, where we are inserting an implant, which is made of silicone most of the time. And therefore, there is always slightly increased risk of problem associated with breast implant. That can be implant becoming harder, which is most common because of scar tissue formation. Each individual reacts differently. Some react more than the others do. Therefore, the hardening is significant. Implants can rupture or leak like wear and tear, like any other implant. Therefore, they need to be changed. Implant can give troubles like very rare breast cancer related to the breast implant, which is well known in the industry over the last 7-8 years. It's called ALCL. So if you take average 10 women, one of them can get a breast cancer. Unfortunately, that's the statistics. Whereas if you take, say, 15 to 20,000 women who has had a breast augmentation, can develop this very rare breast cancer. So it's a very small risk, but it is a risk. There's also a discussion in the wider community of science and the non-scientific community about breast implant related illnesses. In other words, there's a group of people who have had implant, went on to develop certain autoimmune disorders like arthritis, feel that implant is the main reason for it. The science is out there for it. Other than that, as a normal aging process, breast changes with age and pregnancy, weight gain, weight loss, all those things make the implant not to last longer. In other words, in breast change, therefore they need a revision surgery, which means average women who has breast implant may have to have them changed about 8 to 10 years time. I said in the previous question that implants are not for life, first of all. There is a wear and tear, and therefore average lifetime for implant, we call it about 8 to 10 years time. In other words, most of the women may need implant removed or replaced around that time. But a small number will go on to have the implant for 20 odd years without problem. Likewise, a small number may develop problems sooner. Therefore, they need changing sooner than 8 to 10 years time. Breast is dynamic. Therefore, breast changes with normal aging, pregnancy, weight loss, and weight gain. And therefore, breast implants can change with that as normally. Therefore, people may opt to have change of implant or further surgery depends upon how they like the outcome at that stage, or how they like their breast or not. First of all, any woman considering this surgery need to understand that this surgery is to give them self-confidence and more be able to do normal things as they normally want to do. This is for them. It is not medical. It is not life-saving or a limb-saving or a cancer treatment. So it is a purely elective procedure. Second thing is they need to research what is the best option for them in terms of whether it's using an implant, whether they're using their own fat, what type of implant, whether it's above the muscle or below the muscle. And also need to take into consideration whether they are thinking of becoming pregnant soon or thinking of losing weight. All those things will change the breast implant. Therefore, if they are close to having a family or trying to lose weight, then they should consider that first before they have an implant. Have a couple of consultations, probably see more than one surgeon, and choose hospital local to them. Therefore, they can go back to them easily if there's a problem.